IVF, or in vitro fertilization, what's also called test tube babies, seems to be a very complicated procedure, but I think sometimes doctors complicate it unnecessarily. It's just 7 simple steps in order to do an IVF cycle. First is the workup, which is the husband's sperm test, the wife's blood test, her ultrasound scans, to make sure that she is the right candidate for IVF, and if there are problems, these can be fixed. We then actually start the IVF treatment, which only takes usually about 2 to 3 weeks. We start her on injections, which is called superovulation, to help her to grow lots of eggs. And we do ultrasound scans to check that the eggs are growing properly. Once the follicles are ready, we then move on to the third step, which is an egg collection or a retrieval, where we collect the eggs and then send them to the laboratory, where the embryologist will then fertilize them, which is step number 4, where he adds the sperms to the egg. He then cultures them in the incubator, which is step number 5, until he has embryos. And these embryos are then ready to be transferred back into the uterus, which is step number 6. And if there are extra embryos, these can be frozen for future cycles, which means literally within about 20 days you've finished an entire IVF treatment, and you must understand what the doctor is doing and why the doctor is doing it, so that you're in control and you can be sure that you're getting the best quality medical care. 2 simple things you need to remember. One is always ask for photos of your embryos, because this is the only thing an IVF clinic can do, can actually make embryos and then put them back in your uterus. Whether they implant or not is not something any doctor can control. And finally, of course, after the embryo transfer, you have that 2-week waiting period to find out whether the cycle has been successful or not. But this is really something which is a biological process, which is not in your control or the doctor's either. But the more you understand about the process, the easier it's going to be for you and the better your chances of getting pregnant. Have questions? Please feel free to ask me. I'm Dr. Malpani at www.drmalpani.com. Thank you.